Hey guys, today I want to talk to you about something that's really important to me, very personal as well, which is spontaneous pneumothorax, otherwise known as a collapsed lung. This actually happens to more people than you know. The reason I'm making this video is because when it happened to me, I remember struggling and looking for hours and hours without managing to find anything on the internet that could actually constitute good advice and about what to expect, what am I going to get, and everything that comes along with it. So I'm making this video to talk about my experience with the collapsed lung in the beginning and my experience with the surgery that I did following after in order to make sure that I can still fly and do everything that comes along with that. Firstly, I want to talk about my experience with the collapsed lung. So I was literally just asleep doing absolutely nothing when I woke up and I had a stabbing pain in the right side of my chest. I genuinely at first thought it was gases or something that was passing by, but as the time went on, it didn't really go away. So I got into a taxi and went to the hospital by myself. At the hospital, they took my oxygen, did a few exams, told me that I had a collapsed lung and that there's nothing to worry about, that it's very common, and that everything will be all right. They put me into A&E, which is the emergency room, and they laid me down on a bed, put an incision, and put a tiny small chest drain to allow the escaped air into my lung that's causing my lung to collapse to escape so that the lung would reinflate to a normal size. Normally, this process doesn't take longer than 3 days at max. But unfortunately, in my case, I had what's called a failure to reinflate 2 times. So I was in the hospital for an entire week with a chest drain. The chest drain was insanely painful, especially when they turn the suction on to make it suck out the air. You literally feel like someone's sucking every part of your body outside. Luckily, they heavily medicated me, so the pain wasn't as bad as I imagine it would be without. I was on morphine, Oromorph, and I was on codeine and paracetamol, so I had literally super heavy medicated, which made the whole being in bed a lot easier for 7 days. I genuinely don't even remember much of the actual being in the hospital. I remember they opted not to give me surgery immediately, and uh, saying that they only give it to people who do it have a second collapse onwards. So that wasn't really great. I remember being released from the hospital. I was still in a lot of pain. They gave me a lot of medication to take with me. At the same time, I couldn't sleep on my back or on either of my sides. I had to sleep in like an upright slanted position. That was the only comfortable position for my lung and where it would hurt me a lot less than any other position I would try to sleep in. Um, there's this weird bubbling feeling that comes along with this entire experience where it literally feels like there's bubbles kind of escaping into and out of your chest with every breath. That didn't really go away for 6 months, even came back every now and then. It's completely normal. Like, I wish I had somebody to tell me that this is not something should panic over. It's just something normal. Take it easy, and with time, it would go away. So, there's nothing to panic about. The extreme pain, the sudden kind of stabs that happen, as long as they're not very current, they're not really a problem you need to worry about very much. Fast forward 2 entire years ahead, and I decided to get the surgery because I need to fly around because of my work and because of my personal life, and I'd like to go on vacations, etc. So I opted to get the surgery so I can get on a plane knowing that I am not in any danger whatsoever. The surgery, I went into it with the mentality that this is gonna hurt just as much as the lung collapse, and it's going to take me ages to recover and whatnot. I had my surgery on the 19th of December. I am now borderline healthy. I'm not ready to jump back into complete life, but I'm ready. I can walk around, I can dress myself, I can do all of what comes with that. The surgery itself, I was on very minimal pain meds. I was on basically paracetamol, Nurofen, and whatnot, all over the counter drugs. So the pain in comparison to the collapsed lung was very, very minimal. Like it doesn't hurt half as much. I was in the hospital for 3 days, so not that long either. There was no stabbing pain, like as much as there was when I had the first collapse, but there was bubbling that ensued in the next couple of days after having the surgery. So like I'd be sitting down and my lungs would start bubbling, and I'd have to move positions and whatnot. Um, Another thing I really want to bring attention to is because you're constantly in this pain mode and you're anticipating pain, even things that you would usually have, like gases in either side of your body that like kind of shoot pain at you, you automatically link it to your lung instead. So what I'd highly recommend is getting an oxygen meter and just keeping it at home, because that's the healthiest, like most reasonable way for you to know if something's actually gone wrong or if not. If you have any questions regarding pneumothorax, my experience with it, feel free to ask me down in the comments, and I will be more than happy to comment and answer any questions you have from my own experience. But if you have any like important questions, you should always refer to your doctor. They know better than anybody. They've dealt with millions of cases like this. Thank you for watching my video, and I hope this was informing for you. If you have any questions, as I said, please ask them in the comments and I'll get right back to you.